Our mission's always been to give country patients equitable access to healthcare. We've previously focused on what currently exists, but with the clinical trials, we're really bringing tomorrow's treatments out to their doorsteps. We've now screened hundreds of patients in country Queensland and recruited dozens into our clinical trials. And we hope to be offering more and more of these cutting-edge treatments to country patients who would otherwise pretty much miss out.
90% of clinical trials are conducted in the metropolitan area. So by taking clinical trials to regional, rural and remote communities, they will have access to new treatments and therapies and improve their patient outcomes.
So we needed to be a bit more agile and add that flexibility. So Rolf said to me one day, let's go shopping for Winnebagos. Purchased 2 and we've fitted them out to be 100% dedicated to clinical trial activity. We drive everywhere around Queensland in these Winnebagos. One patient who attended his clinical trial appointment who said that he'd been getting chest pain, which was new for him. So we got the doctors to see him very urgently, and then he had emergency bypass surgery. He wasn't due to see his cardiologist for another 6 months. So having access to more frequent appointments actually benefited him and his health.
So I first heard about the clinical trials program. I was actually scrolling on Facebook and saw them advertise for people that are interested in clinical trials, and so I answered that. And then a couple of days later I got a phone call from someone, and it just went from there really. And I just think that clinical trials are a great way to sort of volunteer really, but to help progress medical science and the things that we do in medicine. Clinical trials have routinely been run out of cities and major hospitals, but with these buses it makes it much more accessible. Like I only had to travel to Dalby to get my screening tests undertaken, which from Toowoomba is only an hour, and if those sort of things happen for rural patients, it makes it much more accessible. It's not just about you as a patient, it's about a whole population of people getting better care.
At Novo Nordisk, everything we do is actually driven by one purpose and one purpose only, and that is to drive change to defeat serious chronic diseases. So this alliance with Heart of Australia Research Institute is actually helping us to bring this to life. I could only imagine the different challenges that these people in the bush must face. And we're in the city here, it's 10 minutes down the road, but I bet a couple of 100 kilometres would be nothing for them. Otherwise, it'd be days and days of effort, and how could they possibly get that care? How could they leave their work? How can they leave their family? So the fact that we could offer something to these people is pretty amazing opportunity that we've got to try and make happen.
It means that they don't have to worry about babysitters, they don't have to worry about taking a full day off work, and it just gives them a peace of mind. Indigenous patients are almost entirely excluded from clinical trials at present. Certainly being able to deliver access to clinical trials at their doorstep in a culturally safe environment brings us a long way to trying to improve their participation. So while we are working with Heart of Australia Clinical Mobile Unit, we will learn a lot. We would learn about logistical barriers that are happening. We would learn about community engagement. We will also learn about how that mobile clinical research is actually working. Well, I would like to see Heart of Australia become the recognised delivery partner for clinical trials across the country. Make clinical trials so much more accessible to country patients.
So we're actually breaking down the barriers to that and ensuring that we do create awareness through community engagement.